Hey, Core family, it's Allison, and I wanted to do a blog, just information on vertigo. I have gotten a lot of patients with vertigo, and there's several causes that you could be experiencing this. It's more of a extreme dizzy spell, not like when your blood pressure sort of drops when you stand up and you have to kind of gather your wits for a second. More of like you can't stand up, you're holding onto the wall to not fall over, that kind of dizziness. So you could have reasons like Meniere's disease or maybe some shock or trauma to the head. You could have tumors and big things. Migraine headaches can set off vertigo attacks. But what I normally see is called BPPV, or benign paroxysmal positional vertigo. And benign meaning it's a big deal because it's happening to you, but there's not something super serious going on that needs surgery or anything. And then it's positional, and it's vertigo. So anyway, what is happening with this? You have your inner ear. It's these little circular, and they're in different positions, circular canals in these different positions on both sides of your ears. They're filled with fluid, and they have small hair cells lining the insides of them. Okay, so when you spin around several times, that fluid starts moving and will bend those hair cells a little bit. So the hair cells are saying, hey, we're going this way. It's telling your brain we're moving this way. So when you stop spinning, especially if you've done it for a little while, that fluid will still be moving around. So you're stopped, but you still feel like you're moving. Kind of like a teeny tiny version of a lazy river. I think about that with the water is still going around, bending that hair cell. So that said, the problem is you have three systems of balance. One is that inner ear, those semicircular canals with the fluid and the hair cells. The second is your vision. You can see where the floor is and where the ceiling is and which way is up, kind of thing. And then the third is proprioception. So you have nerves in your tendons and parts of your body telling your brain if you're on your toes or if you're on your heels, if you're bent forward or sideways, where your joints are in space, which is giving you feedback to say, I'm balanced, I need to adjust, I think my weight's too far this way, I need to come this way. So when those three balancing systems aren't together, for example, the fluid's still spinning, but your vision is getting messed up because you know it should be straight, but your eyes start jumping. Your tendons are telling you you're still, but that semicircular canal is not. So when they're not meshing, that's when you have problems with balance and some problems with vertigo. So in vertigo, the kind I normally see, the BPPV kind, is a crystal, they think like a calcium deposit or something, that gets lodged in one of those hair cells in the side of it, so it kind of bends that hair cell permanently. And that hair cell is giving feedback that I'm spinning, and it's not shutting off because it's stuck there. So that's the typical vertigo that I would see come in here. And anyway, I hope that's helped give you a little bit of an education of why stuff is going on.